Hi guys. Okay, so I think it's been a couple weeks since I made my last video. Since then I've been working a lot and doing my routine appointments and medication treatment plan. So I'm just going to update you on what I've done since the last video. Okay, so last time I showed you everything that I had received. I hadn't yet really started my treatment plan. So now it is November 26th. I've been on my treatment for 3.5 weeks, and in that I have my sharps container to put my used needles in, and I always carry around a little pouch with all my medicine just in case I get caught at work or something and I don't have time to come home. So I'm just going to go through like my daily routine of what I do and what's coming up. Okay, so first of all, every morning I take this tiny blue estrogen pill, and I take one at night as well. So I take one as soon as I wake up, and I take one with my medications at night. So I have that orally. I also have 2 patches, which are located right here, and those are 2 estrogen patches as well. And how they explain it is this goes into effect a lot sooner, but it doesn't last as long, whereas the patches take a while to start working, but they last a lot longer. I change my patches every 3 days, and I take these twice a day. What else I do is I take between 4 to 8 baby aspirin. Just helps with everything. And then I have these prenatal vitamins, and I take 1 gel and 1 solid once a day. And then I have, I have my Lupron. So this has been 3.5 weeks, and I still have a little bit left. I should be taking this until about mid-December, and I do that once a day at 7 p.m. with this insulin needle. And I actually just had to reorder some of these because I have these needles and then these needles which come with the kit. I prefer these ones. These ones are more comfortable. These ones feel like they pinch, and I don't like them. I don't know why. Every time I use these I get bruised. I don't know why, but these ones are fantastic. And I was actually looking at the tip of the needles. This one has a shorter, less slanted tip. This one has a longer, more slanted tip, so I think that has to do with it. But I like these ones. So I've been using all of these, and I'm almost out, whereas I still have tons of the other ones. So, alrighty. So first thing I'm going to do is just take all my pills, and I probably should have gotten a drink for this. So I will do all my pills after, since I did not prepare. So, and then I always have 2 alcohol swabs. I use one to clean off the vial, and then I use one to clean off my skin. So I always clean this off because you don't want to risk contaminating the medicine and getting an infection. That would be quite awful. So I always clean it, wipe it down. You can tell I've stabbed this thing a lot of times. And then I let it air dry. And while that's happening, I take off the safety pieces of my needle. And see, this one has a really nice slanted tip. I don't know if you can see it. But I was on 10 units a day. And about a week ago, I went down to 5 units a day. So I always go to the 6 mark of air. And then I put it in, and I inject the air and take out the medicine. And I always go slightly past the 5 because I always push the bubbles out, and I want to be exact with my dosage. And I do this at the exact same time every single day in the exact same way. And lately I've had a ton of monitoring appointments. Oh, and I always put the cap back on it while I'm preparing because I don't want to drop it and contaminate the needle. So I always do that. But I've had a bunch of monitoring appointments, And on my first appointment, I get my results back a couple hours after I go. I go at 8 a.m. every single day to a place near my work. By 3 p.m. I have my results. And the first day that I had my monitoring appointment, I actually got a call and they scared the crap out of me because they said my estrogen was so high, and I hadn't started my estrogen yet. But they said it was so high that they thought I was pregnant. Well, I couldn't be. I was doing everything they told me to. There was no possible way. So I had to be in the hospital over the weekend to get my blood drawn because they refused the blood test unless I was admitted in the hospital. So I spent my whole Saturday morning doing that. So I immediately got my results back for that, and I was not pregnant. Thank God, because I didn't know what I would tell my IP, because what are you, that's breaking the contract. You can't be pregnant. So that scared me. But after that, I've had 2 monitoring appointments since then. So I've had 3 total, and I have 1 more on Monday. And every time I go, I just get blood drawn, and I get an internal ultrasound to look at the follicles on my ovaries and the thickness of my uterine lining. Last appointment, they said my estrogen was really high, which I guess is good. It's in the right range. It's just higher than most people's. And my thickness is 6 centimeters, and it has to be a 7 for my transfer. So I'm doing so good. And on Monday, my IP started her treatments. So our estimated transfer date is the 9th or 10th of December. So I'm very excited. I'm so excited, and I can't wait. So that's my update on my doctor's appointments. So I have another one on Monday, and then my transfers the next week, and then I go back the next week for my pregnancy test. I'm so excited. Alright, so now I'll do my injection, and then I'll do my oral medication after. So I'm just gonna push this down, and I always hunch over so that I have enough fat or subcutaneous tissue. And I prefer my right side over my left. I don't know why, but I do. And then I always kind of touch it, make sure I know where I want to go, kind of plan ahead. And then I clean the area with my alcohol swab. And my mother always told me that touch overrides pain, like the sense of touch. So I always touch the area, and I engage it before I actually stick the needle in. And I do my needles very slowly. I don't know why, but it's more comfortable to me that way. Okay. And then I just put it right in. I pull a little bit out. And then I just make sure that it doesn't bleed or anything. So it's very quick, easy, and I do it every single night. It's now just routine. It's not a big deal. And I didn't bleed. So everything is good to go. And then I always put the cap back on the needles, and then I put it in my shirts container. And this thing's actually pretty full. It's got like 30 in there. So it's as simple as that. So then all I have to do is take my handful of oral pills, and then I'm good to go. Now for my next step, I have a couple of new things. I have the progesterone. This is a vaginal, and then the doxycycline, and then I also have my progesterone and oil. These are in sesame oil, so they're really thick, and I have a little pouch I set up for 2 injections, so that you have to withdraw it from the vial in a thicker needle and then inject it in the intramuscular with a smaller needle, but it's still pretty thick and it takes a while to inject. So once I get to that part, I'll show you guys. I'm not too worried about it. I just made the mistake of looking up online how to do it, and that scared me. So I'm hoping it's easier to actually do it myself than to watch other people do it, because the thought of having someone else do it freaks me out. But my IP said that she can't do her injections. She has to have her husband do it. So I don't know. I guess the surprise factor does not really sit well with me. I like to know when it's coming. So that's all there is, and when I start the next step, I will let you guys know. Otherwise, everything's going great. And I posted on Facebook, and everyone's been so excited and supportive and so happy, and I've had a wonderful time so far. And I just can't wait to get the pregnancy test that's positive so that I can actually feel like it's for real. So that's it. I'll talk to you guys later. I hope you enjoyed. Please subscribe, comments, questions, anything like that, and I'll reply as soon as possible. Alright? I'll talk to you guys later. Have a great day. Bye!